Hi, I'm Dr. Lord. I'm a retina specialist from Southern Utah, and I'm going to talk to you today about macular degeneration. First of all, I want to go back and explain a little bit about how the eye works, and then we'll talk about the disease itself. So this is a diagram of an eye. This is the front of the eye, the clear part of the eye called the cornea. This is the color part of the eye called the iris, the lens, and this orange structure is called the retina. Light from the outside world comes through the cornea, through the color part, through that pupil, that dark part in the center. It's focused by the lens onto the back of the eye called the retina, and a portion of the eye called the fovea that's in a portion of the eye called the macula. Those electrical signals get transmitted through the optic nerve and it goes back to the back of the brain, and that's how we perceive and process images. Now, not all of the retina is created equal. There's a portion of the retina called the macula, and that's where all the high acuity vision occurs. It's like a 500 megapixel camera, and everything else is a 2 megapixel camera. It's where all the cones and the color sensing apparatus of the eye is located. And it's really that high acuity forward facing central vision that people have. And it is kind of the main area that's affected in macular degeneration. It's kind of like gray hair and wrinkles with macular degeneration. Everybody over 65 has a little bit of these changes, kind of a wearing out of that vision processing center in the eye. And it is the number one cause of vision loss in patients over 65. And we think that there's a environmental component, but also a strong genetic component to macular degeneration. There are two different main types of macular degeneration. There's what we call a wet or exudative macular degeneration, and there's a dry or a non-exudative macular degeneration. The wet form we treat with injections of medicine we put inside the eye monthly. And there's 3 different drugs that are on the market today in the United States: Avastin, Lucentis, and Eylea. And they target that wet macular degeneration. And originally, when we did treatment for macular degeneration, we did the studies, patients got an injection every month for 2 years. Nowadays, we kind of tailor it to how well the patient responds. And most patients with treatment either maintain or improve their vision. Macular degeneration and the treatment of what we call anti-VEGF or anti-vascular endothelial growth factor, that's what those injections are. They're little antibodies that we inject inside the eye, and they treat the growth in wet macular degeneration and cause it to regress. It is the very best treatment available for patients with wet macular degeneration. We tried for years, decades, to treat macular degeneration, and it's only within the last 10 to 20 years that we've really gotten better or gotten good at halting the progression of the most severe form of macular degeneration, the wet form of macular degeneration. There are many other treatment modalities being investigated and researched, but right now the monthly injection of anti-VEGF with Eylea, Lucentis, and Avastin is the very best available. So backing up what causes macular degeneration, we think there's a genetic component. We think there's an environmental component. We know that Caucasians are at a little higher risk for macular degeneration. We know that the longer a patient lives, the more likely they have some form of macular degeneration. We know that there's a strong inheritance component to macular degeneration, and it's fairly common. It is the number one cause of vision loss in patients over 65. And so chances are, if your mom and dad had it, you have a high likelihood of having this condition. How do we diagnose macular degeneration? So we have a host of different tests, but basically you need an eye exam. And we have what we call an optical coherence tomographer, which takes a scan of the macula. We have fundus photography, we have fluorescein angiography. Those all help us in the diagnosis. The symptoms of macular degeneration are common as well. It's basically a central blurring or central blackout of your vision. And if you've started to see a spot in your vision that doesn't go away in the center, that could be an early sign of macular degeneration. So what can we do? We've already talked about some of the treatments for wet macular degeneration. For the dry form of macular degeneration, there are some treatments, but we also think there can be a little bit of prevention. We recommend patients eat right, have a healthy diet, get a lot of the antioxidants and nutrients in their diet. We recommend that they use polarized lenses or lenses that block UV radiation, We think that UV may play a role in macular degeneration and also may play a role in cataract formation. So we recommend patients have a healthy diet, eat right, and we also recommend that they don't smoke. Macular degeneration does not fix itself. There's not a way that this is going to go away on its own. And even with the dry form of macular degeneration, even with taking a lot of the nutritional supplements, this is not going to go away. We think that the nutrition supplements like the AREDS and the AREDS 2 studies where we had a high antioxidant blend of vitamins like A, C, and E, zinc, lutein, zeaxanthin. We think that it helps a small subset of the patients with macular degeneration from progression to the more severe form of macular degeneration. But it is not a magic bullet. You still can progress to more severe forms. It does help. We did very large studies. We looked at a lot of patients, and it does have some therapeutic benefits, so we recommend it across the board. We do not recommend that patients take vitamin A if they are smokers. Macular degeneration has a slowly progressive course. So if you've got small changes, chances are in 5 to 10 years, those changes will get worse. If you've already experienced vision loss from macular degeneration, will it get better? The answer is probably not, unless you have the wet form, which the answer is probably yes. If they have the wet form of macular degeneration and we treat it, about 10% of patients will regain some of their vision, maybe even higher. But the real beauty of the injections for the wet form of macular degeneration is that we can maintain their vision and do a pretty good job. Can total blindness occur? No. Macular degeneration patients just lose that central vision. Most patients retain their peripheral vision indefinitely. And while we've come a long ways with treatment for macular degeneration, we still have a long ways to go. If you are sensing a change to your central vision, you need to see an eye doctor right away. And if they suspect that you have the wet form of macular degeneration, they'll refer you to a retina specialist or to an ophthalmologist who can perform the treatment to get you better and at least stabilize or maintain the vision that you have. That's basically all the components of macular degeneration. I talked about the vitamins for AREDS 2 and the injections that we use to treat the wet form of macular degeneration. Hope you enjoyed this video, and appreciate you listening to me today.